My double eyelid is sometimes a monolid. What causes this?
A double eyelid or an eyelid crease occurs in about 50% of people of Asian descent. This is a situation where a little fold occurs so you see more of the eyelid from the eyelashes to the eyelid crease. This is in contrast to a monolid where you don't see a crease or a defined fold. Patients have come in with one double eyelid on one eye and one monolid on the other eye, or having an intermittent crease, meaning that sometimes they had a monolid and other times a double eyelid. This variability in eyelid crease stability is not unusual. The explanation for this eyelid behavior is found in the underlying anatomy and other factors. I'll discuss how I approach this with patients who come in with concerns about eyelid creases that come and go. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. One of my areas of specialty is Asian eyelid surgery for both primary and revisional surgery. I have a lot of experience performing Asian non-incisional and incisional eyelid surgery, as well as other procedures such as ptosis surgery and epicanthoplasty. What differentiates a double eyelid from a monolid are the anatomic attachments between the levator muscle, which is responsible for lifting your eyelids, and the connections to the eyelid skin. The levator muscle has fibers that attach to the skin. When somebody has a defined eyelid crease, it means that these fibers have a strong attachment, and if somebody has a less defined eyelid crease, often it is because they have multiple fine attachments that are a little weak, or they don't have any attachment at all, and all they see is passive folding over of the skin, which results in a monolid. Sometimes people can wake up with puffiness or fluid around their eyes, and this can obscure these weak levator muscle connections to the eyelid. I've had patients report that when they're a little dehydrated, their crease gets deeper. In other situations, the sudden absence of an eyelid crease could be associated with allergies, sinuses, excess salt intake, essentially anything that makes the eyes puffy and cause this crease to be less defined. This may be a cosmetic concern for many people because of the difference between the two eyelids can make their features look asymmetric, or even make one eye look bigger than the other. To address this concern of uneven eyelids due to a weak levator muscle connection, Asian double eyelid surgery can be done. When performing this procedure, there are two techniques that can be employed. The incisional technique, where an incision is made on the eyelid to remove skin and address fat that's preventing eyelid crease formation, or the non-incisional technique, where small openings are made on the eyelid through which stitches are passed in order to connect the skin and the muscle. Regardless of whichever type of method is done, the basic principle of this procedure is to achieve a double eyelid fold by creating a strong connection between the skin and the levator muscle. In order to create a natural-looking double eyelid, I take into account factors such as age, gender, skin thickness, skin quality, skin quantity, fat volume, how well you've healed from past procedures, and your bone and soft tissue anatomy around the eyes. Based on this information, I make recommendation for either the incisional or the non-incisional method. If there is extra skin and fat present in the upper eyelid, an incisional approach is performed. After creating a design for the skin to be removed, the surgery is performed, and in addition to the skin that's being removed, it's common to remove a small volume of fat to help establish an unobstructed connection between the levator muscle and the eyelid skin. It's critical to avoid removing too much skin or fat, as it could lead to complications such as hollowing or eyelid retraction. If there is no excess skin or fat present, which is often the case in many younger patients, I do the non-incisional method. In this approach, I use a Q-tip or an instrument to create a crease which looks natural and place marks where I need to pass the sutures. The sutures are passed through small openings to attach the upper eyelid skin to the underlying levator muscle. This will result in the eyelid skin folding in when the eyes are open. The approximate time for incisional upper eyelid surgery is about 1 hour. It's shorter for non-incisional surgery. All procedures are done at our certified operating facilities under local anesthesia with intravenous or IV sedation. Our patients are comfortable and really appreciate avoiding going under general anesthesia. A week following Asian eyelid surgery, sutures are removed for incisional surgery. In both incisional and non-incisional Asian eyelid surgery, the eyelid crease can look a little bit high in the first few weeks to months due to swelling between the crease and the margin. This swelling continues to improve and is usually not an issue as far as going back to work or social activities. Practically speaking, having a variable eyelid crease is addressed by creating a connection between the levator muscle and the eyelid skin. If you're ready to consider Asian eyelid surgery, I recommend you meet with the qualified, experienced eyelid surgeons who have a lot of experience with Asian eyelid surgery. A proper examination will further reveal any other issues that can potentially be of benefit. I can tell you from experience that Asian eyelid surgery patients have been consistently satisfied with their outcomes as they feel confident about revealing the true shape of their eyes while retaining a natural Asian appearance. I hope you found this information helpful. Thank you for your question.